Very much, everybody, for being here, and certainly, I guess, apologise up front for a slight delay in the release of the report. The department had anticipated doing this a short while ago. Minister Collins was eager to get it out, but as you all know, there was a shuffling of the decks, and he's moved on, and I moved in. So we're here today. It took a bit of time for me to read the report and to certainly get an understanding of what it was all about before I would share it with you people. But thank you for coming. It's an important document, and I'm certainly pleased to be here today to make a few comments and have a chat with you about it. As many of you probably would remember, following the release of the Office of the Citizens Representative report back in March of 2011, the Department of Justice committed to conduct a peer review into psychiatric service at correctional facilities in our province. The department engaged this peer review to seek a thorough, independent, and objective review of psychiatric services in correctional settings in Newfoundland and Labrador. In order to ensure that the review was independent and was completed by a medical professional, the department engaged a forensic psychiatrist with an understanding of corrections. Dr. Philip Klassen is a well-respected psychiatrist and is the Vice President, Medical Affairs with the Ontario Shores Centre for Mental Health Services. Dr. Klassen also has previous experience working in a correctional centre as a consultant psychiatrist for the Kingston area penitentiaries. His report was submitted to the department on September the 19th, 2012. It was important that this review did not reflect individual views of Dr. Craig or those of the Department of Justice. It was important that the review be objective and independent and that it be carried out by a medical professional. Dr. Klassen's report concluded that Dr. David Craig, the psychiatrist providing psychiatric services in provincial correctional facilities, meets the standard of care where the standard is comparable service provision in other provinces. He also stated in the report that Dr. Craig, and I quote, is clearly practicing to an acceptable standard, and that, quote, Dr. Craig's prescribing practices are very typical of the prescribing practices seen in correctional settings. Dr. Klassen acknowledged that correctional mental health services can be improved in Newfoundland and Labrador and elsewhere, and outlined 5 recommendations to improve services. Formally extend the recovery model of care to correctional mental health care. Provide guideline-driven services. Enhance communication with inmates and patients and community stakeholders. Contract for service provision with an academic mental health service. And consider adding mental health services to the Correctional Balanced Scorecard. Today, I am pleased to be releasing this review in its entirety. I accept Klassen's recommendations and will work immediately to implement them in collaboration with the Department of Health and Community Services. I am confident that this will further enhance the delivery of mental health and addiction services in our provincial corrections system. I recently met personally with Dr. Craig to discuss the review, and he advised me that he will cooperate fully in implementing these recommendations. This work, ladies and gentlemen, will build on important investments our government has made in recent years, which has resulted in further enhancement of our provincial corrections system. Since the release of Decades of Darkness, Moving Towards the Light in 2008, the provincial government has invested approximately $8 million to improve corrections, including the enhancement of mental health services to inmates of all provincial prisons. This includes the provision of psychological services and the provision of mental health training for all staff, the hiring of a full-time psychologist, an addictions coordinator, and a second nurse at Her Majesty's Penitentiary, programming enhancements, including addictions counseling, drug awareness, violence prevention, employment training, structured leisure activities, mental health improvements, and women's programming. Some of these have occurred through strong partnerships with the Canadian Mental Health Association, the John Howard Society, Turnings, and Stella Burry Community Services. A multidisciplinary team has been operational at HMP for the past 2 years, and this team is consultative in nature and includes a psychologist, nurse practitioner, general practitioner, and the psychiatrist, representatives from the frontline, security staff, classification, as well as the Canadian Mental Health Association. The team meets regularly to engage in case conferencing and to discuss aspects of mutual concern relating to mental health clients. We've also hired a fetal alcohol spectrum disorder project coordinator, a full-time Aboriginal correctional liaison training coordinator, and Aboriginal prison liaison positions at the Labrador Correctional Centre. The hiring of an Aboriginal prison liaison position at the Newfoundland and Labrador Correctional Centre for Women has been completed, and the Justice Project offered by the Canadian Mental Health Association Newfoundland. This program provides in-reach services for those inmates at HMP who have been diagnosed with mental illness. It provides a continuity of mental health care services from the prison to the community. The Canadian Mental Health Association social workers have a strong presence at HMP and carry an active caseload of up to 25 clients. Their workers collaborate with classification and other institutional staff members, as well as the psychiatrists, to help those with mental illness to cope with imprisonment and to prepare for their release. And this program is jointly funded by the Departments of Justice and Health and Community Service. That concludes my formal remarks. I want to thank you all so much for being here.